So, welcome to another episode of Success in Cardiology. I'm Dr. Deborah Lockwood, and today it is my great pleasure to introduce you to Dr. Claire Martin, who is consultant cardiologist and electrophysiologist at the Royal Papworth Hospital in Cambridge. She's also affiliated assistant professor at the University of Cambridge and did a PhD there on the mechanisms of Brugada syndrome. So, welcome, Claire, and we're very pleased to have you. In addition, Claire is a mother, so she fits in very well with our wish to showcase women who've been successful in cardiology and been able to have a family. So, Claire, welcome. Can you start by telling us a little bit about how you feel you have managed to be successful in cardiology?
Okay, well, thanks very much, first of all, for asking me here today. I'm really happy to be able to speak to you about this. Yeah, so that's quite a sort of general question to start off with. I guess the bottom line is it does require a bit of balancing work to sort of plan your life out, to work out what your aims are, both in terms of your career and in terms of your family and home life, and to work out sort of a strategy as to how you're going to best manage that. I guess from my perspective, in a way, I was quite lucky because I always kind of, from quite a young stage quite an early stage in my career, I was really interested in cardiology and specifically interested in electrophysiology. So I guess I was quite focused that was what was a sort of passion for me in terms of my career, and I sort of wanted to kind of follow along those lines. However, it sort of never really occurred to me that I needed to give up other aspects of my life in order to follow that. And I guess I have always wanted to have a family and have children as well. So from the sort of outset, I wanted to kind of be able to balance those two things. I I think it helps to have some kind of strategy and to have some kind of plan in mind. Now, obviously, that doesn't always work out if you're, looking at your family life and whether you want children or not. And I guess, again, I was kind of lucky that I was able to have children at the time that I wanted to have children, which is obviously not always the case for everybody. For me, I had children quite early in life. So I had children when I was 27 and 29. So I have two children and they are nearly 14 and nearly 16 now. I guess for me individually, that kind of worked out in terms of my career life, just because at the time when I was training, we had something in the UK called Modernising Medical Careers, and I don't know whether anyone remembers that, but it was a certain thing that was set up whereby when we went into registrar training, it was a sort of nationalised programme where we had to kind of apply for sort of specialties right from the outset, and it kind of didn't leave much flexibility for clinical training. I was a bit concerned at that time because I did know that I wanted to do cardiology and didn't really want to do anything else. So I also, in parallel, applied for PhDs at that time, whereas otherwise I might have gone into clinical training first and then done a PhD sometime during the line of that. But basically, because of this, I went to apply for PhDs early and got funding from the Medical Research Council for a PhD studentship. And then because of that, I then felt that it would be easier in my life to have my children whilst I was doing research. So in a way, that's kind of why I ended up having children maybe a little bit earlier than most people in my position. But actually for me, that worked out quite well because I had a bit more flexibility during my research time to be able to kind of juggle those two aspects.
And did you always want to do a PhD as well, or did you just feel that was something that was necessary to make you stand out from the crowd?
So I have always been interested in research. And even when I was at school, like I think if I hadn't become a doctor, then I would have become a research scientist. So I was always interested in it. And in fact, my job now does continue to combine clinical work and research work. Um, I think it's increasingly true, though, particularly for specialties like cardiology, that you do need to do some research, even if you don't want to do it later on in your life as a trainee. You need to kind of show some interest in it. Not necessarily to do a whole PhD, but yes, it is something that is sort of part of the training platform now. And for me, yes, so I guess all those things kind of worked out. It was something I wanted to do. It was something that I knew would help me later on in getting a job, even if it was a 100% clinical job. And also, to be honest, it did allow me that flexibility for a few years in order to have children. And that's not to say that I didn't, I did work hard during the PhD, but it was just a different type of work. And it did allow me to sometimes work from home a little bit more and kind of control my timetable a little bit more. And obviously, that does depend on the PhD you do as well. I did a PhD in basic science. And I was just able to kind of control my life a bit more during those years. So I did a 3-year PhD, but I did it over 4 years because I took 2 sets of maternity leave. And the way that it worked out for me, which I realize is going to be quite individual for each person, but I was pregnant during the first year of my PhD and spent that time collecting a lot of data. I then spent quite a lot of the second year of my PhD. Obviously, I was on maternity leave for some of it, but then also spent a lot of it kind of working from home, kind of writing up that data. Then in my third year, I was pregnant again. And then in the fourth year again, I did the similar thing. So I was on maternity leave for some of it, but again, I spent some of it kind of working from home, writing up their data. So it just gave me more flexibility. Now, I appreciate that's not going to work for everybody's PhD. It just depends on what they're doing and what their daily life involves in doing their PhD. But I just felt for me it was easier than, for example, the less flexible life of being in the hospital and being on call, having to work evenings, having to work weekends. If I was working at the weekends or in the evening, I could do that more readily from home if I was kind of analysing data and writing up manuscripts.
Great. So you are one of really still very few electrophysiology consultants in the UK, and indeed there are very few electrophysiology trainees also. So did you get any kind of feeling of opposition or resistance to you going into this specialty, specifically as a woman?
Yeah, I think that's a really good question. I think when I first decided that, as I said, I decided quite early that that's the field I wanted to go into, even before I really realised what it involved on a daily basis. But I always liked ECGs when I was, learning about them as an undergrad, and I liked the idea of being able to do something more kind of practical. So that was a kind of obvious thing that combined those two things. And I don't think it ever occurred to me, or I noticed really at the outset, that there was such a minority of female representation in that specialty. And it's true that as I kind of then progressed through training, it became sort of a bit more obvious to me. And I certainly did have comments at times that it wasn't necessarily the sort of best specialty for women to go into for various reasons. I guess the kind of person I am, I sort of just ignored them and it didn't really bother me. But I can see, particularly with hindsight, that for other people, it would have bothered them. And also just the fact that there's a lack of female mentors out there, I think is quite important for a lot of people, whether that's on a kind of a sort of very obvious level, or whether it's on a more kind of unconscious level, that you tend to go into fields where you see people that you want to follow, that they've already made a path for them, and you follow those people, and you tend to follow people who are sort of more like yourself. And one of those things that marks that out is gender.
Yeah. So what do you think we should do to try and get more women to go into EP?
Yeah, again, very good question. So I think we have to kind of look from the basics to kind of work out, why it is that so few women go into EP. And I think there's probably quite a number of different reasons, actually. I think if you look at EP, if you think of medicine as sort of being part kind of art and part science, I guess EP does fall like a little bit more on the science side of those things. And if you even kind of look back at school, you can see that women, fewer women go into, they study physics and engineering sort of less frequently, and it's something that they kind of less frequently go into. And I think that just from those beginnings there kind of is one of the answers why fewer women go into EP. So I think just from a very young age, from school age, they need to be kind of encouraged to see themselves as someone who can do physics and engineering and all those things that are kind of traditionally more male specialties. Then once they enter medicine, yes, I think that it is then important to have female role models. And I guess that's something that will hopefully grow with time as more women go into the specialty, as they become consultants. But I think also the consultants that we have at the moment have to be quite proactive, kind of encouraging women trainees to go into EP and show them that although we don't have the numbers at the moment, we certainly could do, and it's something we can build towards. I think that there are certain maybe more practical reasons why women kind of might sort of think that EP is a difficult thing to go into, and it's probably similar reasons why they don't go into sort of more surgical specialties as well. I guess that the very nature of doing cardiology, similarly to doing surgery, the job is a little bit more inflexible in terms of the schedule, just because you have, cath lab lists or operating lists. And I guess that can be harder to juggle with family life. And this is, I think, something difficult to discuss because it is something that's quite individual on how you run your life ultimately. Because if you are in a family situation where you are the person who has sole responsibility for looking after your children, like if you're the one that has to take them to school and pick them up from school and be in charge of ferrying them around and in charge of their meals, and if that sole responsibility falls to you, then that is going to be harder to balance that with a specialty which has sort of fixed operating times. And then I guess it is up to you then within your family life to try and sort out an arrangement where between you and your partner you have some more balanced way of arranging those things. Or as a family, you agree to have some outside help or have other members of the family help you. And obviously that's difficult because that's sort of, that's a very individual thing. Obviously, some people are single parents and it's not easy to necessarily juggle all those things, but I think it is something worth thinking about. So within our family, me and my husband both work full time and we both have sort of, quite busy careers, but we've always shared those kinds of sort of aspects of family life so that both of us can kind of, balance those things through our careers. And, sometimes there's times when I've done more of it. So when I was, doing my PhD and the children were very little and I was breastfeeding them, then obviously that sort of fell more to me. But in fact, later on in my training, I spent a year before I got my consultant position at Papworth, working in Bordeaux in France. And there I commuted weekly. I used to go on a Monday and come back on a Friday. The children were 6 and 8 at that time. And during that year, my husband did more of the work because I wasn't there during the week. We also had help from my husband's mother, and that was also very useful. And all those things, obviously, are going to depend from family to family. But if you can work out a way where you're not the person that's taking that whole responsibility, and that is obviously going to be easier. And it's not just in terms of the kind of physical ferrying around, picking up things. It's also in terms of the mental load. Like if you're the person that has the sole responsibility for making sure that all these things happen, then that is obviously going to kind of add to the sort of daily stress of your life. So if you can share that responsibility, that's obviously going to be better. There's obviously things that the workplace can do to make those kinds of things easier as well. So whilst there are going to be some scheduling sort of inflexibilities in terms of sort of cath lab lists and things like that, if the workplace can make it easier for people to work less than full time, then that's going to be very much make things easier for some people to be able to fulfill their career. Now, as I said, I took 2 maternity leaves during my PhD. Then when I went back to work, I have always worked full time, but that isn't necessarily going to work for everybody. So I think the workplace has to, your workplace has to understand that in order to try and get more women into specialties such as cardiology, then they have to be open to less than full-time working, which I think they increasingly are, but sometimes it's still a little bit of a battle.
So some people are worried that if they went less than full time, they would end up working full time for less than full time pay. What would you say to that?
Yeah, so again, I think you have to be quite firm with your operations team and your HR team about what you're being paid for and what you end up doing. So you have to just keep a very strict record of the things that you're doing and be strict that if you're meant to be leaving at this time or if you're not meant to be working that day, then you don't do that. I guess that's also true for people who are working full time. Like the pressures on the NHS are always that they want you to work more for less money. And you always, even when you're working full time, you have to kind of, be clear and keep a record of what you're doing and when you're doing it to make sure that you are being paid for the work that you're doing.
Mm-hmm. Okay. There are also some people, particularly from some other cultures, who are made to feel a little bit guilty if they're not being a full-time mother, if they have children and then they don't give up work to be a full-time mother. So, what are your feelings about, how well you're able to fulfill the role of a mother while still going to work?
Yeah, I guess that's difficult for me to comment on, in terms of kind of cultural difficulties like that, because I don't think that I particularly had those kinds of pressures. I think if anything, it was felt to be quite normal for me to continue my career. Um, Again, that's quite an individual thing. I certainly think that it's possible to be a good mother and to continue your career. And again, it's in terms of balance. So, you know, you obviously want to make sure that you spend adequate amounts of time with your family, but it's more to me about sort of spending quality time with your family and making sure that the time that you do spend is a positive experience and that you're helping your children in the right way. And that doesn't necessarily mean that you have to always be the one that picks them up from school or does sort of more mundane chores. And if you can outsource some of those things or share the burden of those things, then that doesn't make you a worse mother. It's about the sort of important things in life and spending important periods of time with your children, not just the sort of quantity of time or doing all of the sort of more mundane things, I think.
Mm-hmm. And by having other interests in your life, do you feel also that you maybe set a good example to your children for work ethic and life ethic?
Yeah. So I definitely think that. I mean, I think that, as my children are growing up, they can see that I've sort of balanced, my career and my family life and doing other things. I do a lot of sport and music things outside work as well. And I think all of those things make you a sort of more sort of balanced, rounded person and kind of give you enjoyment in life and make you a sort of fulfilled in what you're doing. And I think my children see that and see that I'm a happy person. And I think that helps our family life as well.
Very much so. Okay, so if you could talk to, um, let's say, a 25-year-old person just finishing medicine training and trying to work out what specialty to do, what would your most important advice be to them?
Yeah, so I mean, I think it's really important that they have a good think about what it is that they really enjoy in life and also how they kind of see themselves 10 or 20 years down the line and how they do want to sort of balance the various things in their life. Um, I think it's really important to follow your passions. Like if there's some aspect of medicine that really fascinates you and that, just feels exactly that you have a passion for, then I think it's really important to follow that. I think it's also important to think about what is going to be sort of practical for you, kind of going forward as well, and is something that's going to interest you not just at that time, but also interest you in 10 or 20 years time down the line. So I think sometimes what you do as a as a student or as a junior doctor might seem exciting or boring on the other hand, but as a consultant, your life might be quite different. And obviously, you spend most of your life, in your career being a consultant, not being a student or a junior doctor. So I think it's important to look forward to seeing what consultants do in that specialty and what their lives are like. And so make your judgments based on that, not just on what you do as a junior doctor. So I don't know. I mean, I liked cardiology as a junior as well, but if the sort of schedule is difficult or things aren't to your liking as a junior doctor, that doesn't necessarily mean that you won't like it as a consultant. You have to kind of look at what life will be like for the majority of the time. I think it is important to look to see whether you will be able to balance that career with the other things that you want to do in life. But I wouldn't be put off cardiology by thinking that isn't possible. Like, it definitely is possible. And I think it's becoming more possible with each sort of coming year. And it's only with more sort of people coming in from more diverse backgrounds and having a more balanced kind of male-female split that will actually make those things more possible in time. So I think it's something that is kind of improving and continuing to improve. And, women who want to do cardiology should not be put off by that because they will be part of that sort of system of improvement.
Wonderful. Thank you very much for your time and for your insights. And if there's any last thing you want to say, then please. But otherwise, I think that was excellent.
Thank you very much. It was great to talk to you today.